In 2023, there were 1,310 fatal overdoses in Philadelphia. That's a 7% decrease from the number of fatal overdoses in 2022. Despite a slight decline, 2023 still had the second highest number of overdose deaths on record. While the total number of overdose deaths fell, this trend was not consistent across all races and ethnicities. The number of overdoses decreased most among non-Hispanic white people and slightly increased among Hispanic people. From 2022 to 2023, there was a small decrease in the number of non-Hispanic Black individuals who fatally overdosed. Since 2019, fatal overdoses increased 17% among Hispanic people. Overdoses decreased 19% among non-Hispanic white people. Overdoses increased most among non-Hispanic Black people, with a 61% increase over the past 4 years. Overdoses impact people living throughout Philly. While Kensington has historically seen the highest number of fatal overdoses, other areas in North Philly and West Philly are also seeing increases in fatal overdoses. Most fatal overdoses in 2023 happened inside of people's homes. The most common drugs involved in fatal overdoses in Philly fall into 5 substance categories. The most common is opioids, a class of drug that's used to relieve pain. These are drugs like fentanyl, heroin, nitazines, codeine, morphine, oxycodone, and carfentanil. Stimulants are substances that increase activity in the body's central nervous system, causing responses like increased alertness and elevated heart rate. These include cocaine, meth, amphetamines, nicotine, and caffeine. Benzodiazepines, or benzos, are used to manage anxiety, and they can cause sedation. These include Valium, Xanax, Ativan, and Klonopin. Sedatives slow down activity in the brain and cause people to become drowsy and often fall asleep or lose consciousness. Xylazine, also called Tranq, and medetomidine are both sedatives. There are many other substances found in the drug supply, ranging from party drugs like ecstasy or ketamine to hallucinogenic drugs like LSD or PCP, or chemical contaminants like BTMPS. More than half of people who died of overdose in 2023 had both an opioid and a stimulant in their system. Opioids, mostly fentanyl, were involved in most overdose deaths. Stimulants were involved in 70% of fatal overdoses. Xylazine was involved in more than a third of overdose deaths, slightly more than in 2022. And every xylazine death also involved fentanyl. In 2023, about 3/4 of overdose deaths involved 2 or more drug types. If you or someone you know is using substances, there are steps you can take to prevent overdose. First, make sure to get the overdose reversal medication naloxone and learn how to use it. Second, use fentanyl and xylazine test strips to check and make sure that the substance you're using does not contain another drug. Third, if you're using a substance, start with a small amount and take time between uses. Fourth, use near other people so that if you do overdose, someone is around to intervene or call for help. Find out how to get naloxone, test strips, and harm reduction training for free at substanceusefilly.com/get-supplies. Philly's drug supply is changing quickly, and the Department of Public Health works to monitor and alert the public about new substances and threats to health and safety. Visit substanceusefilly.com/alerts to find up-to-date information about the city's drug supply.